It seems like it will never end no matter how hard you try to cancel your thoughts and remember facts. No matter how many times you wash your hands, turn off the gas valve, or avoid contaminated things, you will not be able to release the things suppressed inside you. On the contrary, your stimulation threshold will only grow higher and your symptoms will become more severe. Your OCD is an outlet you chose as a substitute, hiding the truth related to suppression, fixed beliefs, failures and emotions that I have discussed in the earlier chapters. As the truth being revealed is a big shock to you, you are compelled to create stronger outlets more often. As the outlets give you both pain and pleasure, your stimulation threshold continuously grows higher. You get to want stronger stimuli as your body gets used to them. This is another form of addiction. This is the reason why you have to start from controlling your obsessive behaviors. You may be able to take control someday if you can understand deep in your heart the truth we've discussed so far. If you can do so, the only thing left with you will be your anxiety. As you have been dealing with your anxiety using your obsessive behaviors as the outlets, you are bound to be left with your anxiety when you stop repeating such behaviors. That moment can be the true opportunity for you. When you encounter that moment, you can use techniques you have learned to create the normal outlets. Even if you can't do so, you may come to realize that you don't have to repeat your obsessive behaviors anymore. It is just that you need to be patient until you get to realize that. The patience I am talking about is an all-encompassing concept, including the patience in understanding OCD, the patience in personalizing and completely accepting the previously explained mechanisms, and the patience in using your emotional power to control your obsessive behaviors. I met a few patients who were told that they were unfit for psychoanalytic therapy. Some of them stormed out of their counselor's office after being asked if their OCD symptoms were caused by sexual desires or abusive pasts. These are the misunderstandings caused by the counselors who pre-conclude the causes of their patients' OCD without accurately understanding the principles and structures. Specific incidents of the past or the abusive parents are not the things that cause OCD. What you have to look into is the psychological structures inside your mind that keep you from escaping your OCD. It is about the symbols you have inside your mind. You need to understand the type of the prison created inside your subconsciousness as a result of the experiences you had. Even if people experience the same incident, the symbols created inside their minds as a result are different from person to person. This is the reason why you need to understand the structures and contexts. To do this, you will have to come up with the appropriate structural hypothesis and verify it. Counseling is the assisted process of hypothesizing and verifying which you cannot do on your own. It is the process of stimulating patients to find and recognize their errors and relieve them emotionally. Every person's maze is different. Methodologies and techniques are just tools. Depending on the way you use these tools, the outcome you will get will be very different. I told you earlier that a knife which can save many people's life in the hands of a doctor can become a murder weapon in the hands of a robber. You need to use the right tool at the right moment. It may be hard to apply the techniques I introduced on every type of OCD. Like I mentioned, the fundamental and negative emotions which cause uneasy feelings by triggering contamination and contagion obsession are too strong to be mended with other emotions. Even if two people have the same symptoms, the psychological structures that created such symptoms might be different. The severity and difficulty of the symptoms will also be different from person to person. This is the reason why everyone has their own way of finding their maze. On average, 3 to 6 months of steady treatment is required for postural correction. As OCD is caused by the physical and functional damages on your brain, it will take a long time to repair such damages. Personally, I think it is better to organize counseling sessions as frequently as possible so that I can quickly respond to the day-to-day issues you're facing, as opposed to having a few infrequent long sessions. Giving continuous stimuli is the best way to make your brain learn. You will have to approach this with a long-term point of view. If you have strong symptoms that keep you from seeing a counselor, it is better to wait until you get better. If you have relatively mild symptoms, the period they grow worse might be the best time for you to talk to a counselor. If you both have obsessive thoughts and behaviors, you should get counseling when you are doing better, even if you have to get some help from medication. However, if you are the one who only have obsessive thoughts in ordinary situations, it is better to go to a counselor when you start to have obsessive behaviors. I will emphasize this again. If you try to magically get better at once, you will only lose your willpower and give up. The thing that differentiates this book is the OCD treatment technique that connects emotions with thoughts and actions. It is about providing help to healthily and appropriately reveal the emotions that you have been hiding. The key point is to find the psychological structures inside your mind and to apply the appropriate methodologies. In most of the cases, OCD patients do not get better at once. Even if they get better, their symptoms are alleviated gradually over time. It is the process of taking back your control on the things which have been uncontrollable. It is not a process in which current problems of yours disappear magically. It is about reclaiming your autonomous life that has been completely lost due to your OCD. I want this book to become a ray of hope to many people who are suffering from OCD. Furthermore, I want this to be the key that can help people to get out of the prisons created by their OCD. I want this to be of help to those who are trying to escape the state they are in, where their bodies are alive but their minds are not. I sincerely hope so. To help you understand better, I will introduce you some cases of OCD. It will be helpful to go through them thinking of your own experience, using the information I explained so far as a basis. You will be able to find important analogies and explanations as you go through them. Read them one by one but focus on the parts that are relevant, as a few among them will suit your case. What will follow this chapter is the case studies designed to help your treatment. I would like to make it clear that they are the exemplary cases reconstructed with the information extracted from many different cases, not the actual cases of real people. If you are triggered just by looking at the symptoms of other people or likely to be contaminated with other people's symptoms, please skip to case study.